We are final year student of Kekeshwar Physiotherapy College, Rajkot. We are presenting gait pattern in the walker. Walker is one type of mobility aid. It is useful for the patient who need more support. Walker provide more stability than the other mobility aid because they have more ways of support. There are several indications for use of walker like structural deformity, inadequate balance, amputation and injury to the lower extremity and muscle weakness and paralysis of the trunk and lower extremity.
Three types of gait pattern in a walker. First is a full weight bearing, second is a non-weight bearing and third is a partial weight bearing.
First, full weight bearing. Here, patient right leg is affected. First, move walker forward up to patient arm length. First, move right leg, then left, then cycle is repeated.
Second is the partial weight bearing. Here the patient's right limb is affected. So move the walker forward up to the patient's arm length. Then partial weight bearing limb move forward. Here the weight is transmitted partially to the affected limb and partially to the upper arm to the walker. Then move the unaffected limb forward. This cycle is repeated. Third is the non-weight bearing. Here the patient right leg is affected. So move the walker forward up to the patient's arm length. Affected limb is placed anteriorly but do not make the contact with the ground. Here the weight is transmitted through the upper limb to the walker. The second step is move the unaffected limb forward. It's also called the 2-point weight bearing. This cycle is repeated.
Advantages and disadvantages of the walker. Advantage of the walker. First advantage, it's allow maximum stability. Second, it's provide wide base of support. And third, it's also provide anterior and lateral stability. Disadvantages of walker. Walker cannot be useful safely on stair. Second disadvantage, it is difficult to enter through doorstep.